We're still on the topic of addiction and the drivers that drive us to compulsive and addictive behaviors and activities. And today I want to talk about um, chronic pain or physical pain that becomes a driver to addiction. And I want to share a little bit about my own story first. When I became addicted to painkillers, which was my drug of choice in my early 20s, it was partly because I was dealing with spine pain, which is not nearly as bad as it has been in the last 2 years. But the real reason I was driven to painkillers was because of the emotional and psychological suffering that I was experiencing. Painkillers were just like this instant fix, to get me out of my deficiency stories and out of my traumas for short periods of time. Of course, it doesn't work because they're just temporary reprieves, right? Um, but there was some pain that initially drove me to becoming addicted to painkillers. And then after I got clean and sober and started on this path of awakening and embodiment, I spent many years without anything at all, drugs or alcohol. And then about 2 years ago, as I've said before, I started to develop a much more serious spine condition to where my bone spur in my vertebrae was protruding into my spinal cord, creating intense pain, like level 10 nerve energy pain. If you've ever had that, it's like pain emanating from the spine, uh, creating nerve energy that it's not has nothing to do with future tripping or anxiety. It's just pure energy coming from the spinal energy, injury, radiating or pulsating through my whole body. Couldn't even stay in my own skin. Having done so much work around addiction at that point in time, painkillers were off the table for me because I'd worked through the compulsion towards those things. Um, my body just doesn't tolerate painkillers. It also doesn't tolerate almost any drug that has an addictive component. For a while, I took Xanax for the spine pain because I couldn't take painkillers, and the Xanax worked, but I didn't want to keep taking that because of the craving and withdrawal cycle that happens with Xanax. And so I've had to go through various different treatments and surgeries and non-medical interventions, chiropractor, the chiropractic services, yoga, eating right, everything to take care of this chronic pain. And it's gotten so much better over time, for sure. But the reason that I bring this up is because I became acutely aware of how chronic pain can be a driver towards addiction. And we've seen it in our treatment centers. Many people come to our treatment centers, they're addicted to painkillers or heroin because they're trying to medicate chronic pain. This is a very, very challenging topic because chronic pain can really affect your quality of life. Now, I had done so much work on myself that through the 2 years of real intense chronic pain, I didn't fall into a depression. Um, there were a couple of times when I had some suicidal thoughts because the pain was so great, but I never got into a depression. But many people do who don't have this work. Their their mood is affected deeply by the chronic pain. Their quality of life is. So it's not just the pain they're experiencing, but they can fall into a depression. And so certainly there are ways with this work that we work with that depression, along with the stories that get attached to the pain, right? So people will often have deficiency stories connected to their chronic pain, like I'm broken, I'm never going to get better, there's something fundamentally wrong with me. We can use those are deficiency stories. You can use this work to work on those deficiency stories. Just review some of the earlier videos that I've talked about how to work with deficiency stories, and you'll see what I mean. I don't have a lot of deficiency stories around my pain either. So at the time at which I had to start taking some medications for my chronic pain, it was clear to me that I didn't have a lot of the drivers that I used to have. I didn't have the traumas that I'd had before. Maybe a little bit of trauma, but it just wasn't a lot of trauma connected to the spine pain, like psychological trauma, making it worse. And although I did a little inquiry on that, it just wasn't a lot there. Um, and there wasn't a lot there around deficiency stories. I didn't have, by that time I'd done so many inquiries that a deficiency story didn't really get hooked in too much to the pain. Um, I did notice that there was some leftover shame that I had to deal with, and which I'll talk about later in other videos, because shame, again, can contribute to a desire to become addicted to something. But again, that shame got worked out. And so many of the drivers got worked out for me. And the only driver left was this chronic pain. And I think a lot of people are experiencing that. They experience maybe that the chronic pain itself drives them to become addicted or dependent on something. But and also some people have not just the chronic pain, but other drivers with it, like trauma, deficiency stories, whatever else. I didn't really have that so much, except for a little bit of the shame, which I'll talk about later again. So I had to really understand that chronic pain by itself can be a driver, right? And I knew this from my clinical work for sure, but until I experienced it myself, having your own experience with that is so important to see how chronic pain affects your life and your desire to seek healing and medicate it and cover it up. So what I tell people who are experiencing chronic pain as a driver towards addiction is that, you've got to go to the root of the issue. Remember, in the new model of recovery, we don't focus on the behavior. We don't focus on people just on, what are you using to medicate that, or are you abusing that? I mean, of course, that's part of what we do, but we know that we have to get to the root of helping them with that chronic pain, not just the physical part of it, but the psychological and emotional part of it, and the brain's fixation also with the chronic pain. And then if we don't help them with that, they may continue to be addicted to whatever substance they're using to medicate that pain, right? So everybody's different in terms of what drivers drive it, but let's just talk today about the experience of chronic pain driving one to addiction. After having done so much work, I know that the chronic pain alone was not enough of a driver to drive me back to painkillers, because my body would reject those painkillers. Alcohol, again, I'd already worked through that substance, so the alcohol was not going to be a good medicating thing for me. I wasn't going to use that. My body would have rejected it. The benzos helped a little bit, but my body started to reject those because of the sedation effect of that, and because they can kind of put you into somewhat of an altered state. So couldn't use that long term. But I can see that how people would be drawn to those substances as a way to medicate that pain. And so what I tell you is let's work on the pain itself, right? So hopefully in this series, later in this series, I'm going to give you a set of pain inquiries. We're going to maybe do a few videos that just focus on working with chronic pain, because it's its own topic. I'm bringing it in now just because we're talking about addiction, right? So how would I work with chronic pain if it's leading me to addiction? Again, I'm going to have to work through the drivers, right? Or you would. So the deficiency stories, the shame, the trauma, the stories that we tell about ourselves. So for example, let me tell you one story that did not come up for me around the chronic pain, but came up for me when I had cancer in 2012. There was a small deficiency story there around I'm sick. That's a deficiency story. And of course the doctors were telling me you're sick, right? But I had to look into that deficiency story and let go of that identity so that I didn't see myself as a sick person. That was a psychological story that was probably creating more stress in the situation of having that condition. So I had to, again, unhook from that deficiency story that I'm sick or that I'm broken, so that I could have a newfound clarity around treating that cancer without a deficiency story. You may have a deficiency story connected to your chronic pain. Even though I didn't have it with the chronic pain, I had it with the cancer. So you want to look to see, and one way of just finding this out is just to see, just kind of putting your pain out there, imagining it like, here's my chronic pain, my life, looking at pictures of your life with chronic pain, having that in your awareness first, and then just saying this. What deficiency story does this chronic pain bring up in me? Right? And it might be like, well, I'm never going to get better. I'm broken forever. So again, we might just reverse that an inquiry, you would say, I'm going to get better. Okay, and that's not as a positive affirmation. Remember, it's a reverse inquiry. So when you say I'm going to get better, the ego is going to pull up all its proof to say you're not going to get better, you're broken forever, and then now you can watch that stuff. We've brought that worm out of the hole. We can see its words and pictures. We can rest with that. Just seeing those words and pictures until they fall away. Tapping if they're sticky, whatever else, coming down into the body then, and feeling into whatever emotion or sensation is connected with that. You can see the pattern, how we do. Each inquiry is very similar. Coming to the body at the end and resting with that for a bit, staying with it. Using any of the somatic tools, metaphysical hands, the dance, whatever. Spending some time with that, just resting. And then kind of returning to being aware of being aware. And coming back to that inquiry again, right? Putting up the pictures of you in your life with chronic pain, or an image of your body with chronic pain, and just saying, what deficiency story does that still mirror back or bring up in me? And maybe a new deficiency story comes up, like, well, it just means I'll never succeed. My life is over. So again, there's your words and pictures. That's your programming right there. Turning awareness towards that. Witnessing those words and pictures. Just letting them be there with the space around them. No analysis. No deciding whether any of it's right or wrong. Just observing it. Because in observing from awareness, there's a level of acceptance that you can't find in the mind, because you're just observing something as it is, without judgment. And as those thoughts begin to fall away, again, coming back down into the body and working with the somatic body with the various tools. Keep working through that until the deficiency story around the chronic pain feels very light or empty or neutral. And what you'll often find is when that deficiency story connected to the chronic pain starts to feel neutral, you'll often find that the pain itself starts to feel better, because it was hooked into this story, right? The other way of working with chronic pain is just to become aware of the seeking story around it. Because many of us with chronic pain, we get into a new seeking story. That happened for me for a few months during the last 2 years, where I was frantically trying to find the answers, seek the answers to the healing. And that's a noble thing. Of course, we all want to heal. But this seeking story towards trying to constantly heal my experience was creating stress in my body. And we know from science that when you're stressed out or anxious around something, it can actually make the injury or illness worse, make the pain more intense. So one really good practice is just to sit in awareness and watch throughout the day any story that says, I got to do this, I got to do that, I got to go here and do this, I got to try this. That constant seeking story can create stress. So one thing you can do is just simply to watch that story when it comes up. No matter what it says. Just watch it and let it fall. Come down into the body and feel. Let those feelings be felt and allowed completely. And then as that story of needing to heal it falls away, you may have to do several rounds of it, right? As it falls away, more and more, there's a resting in the present moment without that story that I've got to heal it, I've got to heal it, I've got to go do something to heal it, right? And then from the present moment, you can take action to heal that or to help that, but it doesn't come, when you're resting in presence, it doesn't come from that energy of seeking anymore, that time-bound story of seeking, which creates stress. Here in the present moment, you can start to learn how to just rest here and be okay with what is, and learn how to rest with the pain, and start to do some of our work around softening the resistance to that pain. I'll talk about that later in videos, how to work with chronic pain in a much more nuanced way. But the point I'm making here is that just to work with the stories that are connected with the chronic pain. Because if you don't do that, what happens is, when you're living in those stories, it's very easy to go back into medicating that chronic pain in ways that can be very harmful, right? Getting on opiates for a long period of time, being on some other controlled substance for a long period of time can get you into quite a bind with addiction. So just taking care of these stories that are connected with it can keep you in the present moment more and able to manage and cope with your pain from a restful place, in a place that's not resistant to what's happening. And then I'm going to show you again some more tools later. They're coming up around how to help that pain be managed and even to reduce or in some cases eliminate the pain. But the other thing I want to tell you is that we have to be careful in spirituality and not believe that rest and inquiry is the only answer to things like chronic pain, right? Just like if someone came to the work with bipolar or schizophrenia, we might say you might need something else with that, some medication, before you start doing this work, because with those particular mental health issues, inquiry or therapy is often not enough. They need medication, so they have to integrate that medication or some sort of other modalities with what we're doing so they can get well. With chronic pain, it's the same thing. Be open to integration, because rest and inquiry can be incredibly valuable for chronic pain. You'll see that as these videos unfold. We can help you with it. But sometimes you have to take medicine. You know, if you're open to it, sometimes you have to just to function. I've had to. So it's good to integrate, to be open. You know, whether you go to a homeopathic doctor or an acupuncture or craniosacral therapy or Reiki or, you know, chiropractic services or yoga, whatever you do, integrate. Sometimes you have to integrate with medicine because you have to take care of yourself, right? And the less damage that we can do as we're taking care of ourselves, the better. When we're addicted to painkillers or to high-level controlled substances for long periods of time, you know, now we've added an additional problem on top of the chronic pain. We now have an addiction which is which is creating harm on top of the chronic pain. So I just say be open to looking at these chronic pain stories, but also being open to integrate other things to help you with that chronic pain so that you don't have to compulsively go back to these highly addictive substances all the time. If you need help with this, we can work with you online. We can also work with you at our centers to help with chronic pain if it's one of the drivers towards your addiction. So just keep us in mind. If you need us at the Killaby Center, it's killabcenter.com. We have a pain management specialist who works at our center, and we have lots of inquiries that we can do with you around the stories and the fixation with chronic pain to help relieve with that. I've worked with people doing pain inquiries where they were about to face hip replacement surgery or knee replacement surgery, and as a result of the inquiries that we did, they didn't have to have that surgery. I've had people that have been on painkillers for many years, and just by doing these pain inquiries that I'll explain later, they don't need the painkillers anymore. They're managing differently. And I've seen it in my own life, because with this work, I found that I don't have to and don't want to take painkillers. I don't want to drink alcohol. I don't even want to take a benzo unless I really have to. So it's all about reducing harm, and reducing harm has to do with looking at the ways in which we're medicating our pain, and is that a healthy way to do that, right? Are there other ways to deal with this? But still being open to the fact that sometimes we do need medication, or we need something, some other form of physical therapy or something. It's all about taking care of ourselves, right? Taking care of ourselves. And that includes taking care of our mental state when we are experiencing chronic pain. Because depression, the studies show depression often comes with chronic pain. But there are ways to deal with that depression with this work, right? Depression is really often just a solemn mood or malaise that stays with us because we feel hopeless, right? That's an internal story that we have and a set of emotions, and inquiry is really good at unhooking that for you. There are also other ways of dealing with depression. Ketamine therapy, TMS, sometimes depressive medications for depression. You have to decide what's best for you. I'm just saying integrate, because this is your life. Take care of yourself. And I think that it's not necessarily the healthiest way to take care of ourselves is just to keep swallowing pills every day. You know, if that's the only thing we can do for now, that's fine. But you'll see that that creates some damage in our life quite often. And then we have to then get off of that and deal with the real issues. What I'm saying is, before you get to that place, let us help you with those issues. Or even if you've gotten to that place where you are using heavy substances to deal with your issue, or food or whatever, it's still not too late. It's still not too late to pull that back and to work on the driver, the root of it all, and to clear that instead of continuing to reach for those more damaging substances. More to come on pain and pain inquiries in the future. This is just an introductory video to that topic of how pain drives us to addiction. Later on, I'm just going to talk about pain itself and give you some inquiries around that in some later video. Thank you.